They have the same problem or they have the different problem? Different? What do we suspect? What differences?
There may be any malignancy, old age, or an elderly.
So,
we may suspect the carcinoma. Carcinoma rectum or anal canal.
On whom?
Grandfather.
Grandfather. And what do we suspect in the brother?
We may suspect the hemorrhoids.
Hemorrhoids in the brother. Yes? So, he may be right. Why I explain this case, we should be careful considering the risk factors in the patient. Yes? So, this will be helpful to differentiate this condition as well. This is important for you because you're going to the 5th year. Yes or no? After that, you'll be the doctor. And the thing is, you have to know how to solve the cases. Yes or no? So, if you see these similar scenarios, one case the patient is 65 or 70 years old, next the case patient is 30 or 35 or 40 years old. Yes or no? The case scenario, the symptoms, same in both of the patient, but the case will change because of the age factors present. Yes? One is 35 or 40. The cancer in the patient is less chance. Yes or no? Because we don't have the family history. Yes or no? But the next patient is 60 or 65 years old. Yes? The patient has higher chances of developing the colorectal cancer. Right? So what should we suspect on both of these patients? In the brother, we suspect patient may have the internal hemorrhoid which is non-painful. Yes or no? So only the flash of blood we can see. Yes or no? But the 65 years old or 70 years old grandfather who may have the colorectal cancer. And one thing we have to remember is any patient more than 50 years old who has, hey you, no talking, any patient can go colorectal cancer. Is that clear? Understood? Any patient more than 50 years old, painless, colorectal, bleeding, suspect for what? Colorectal cancer. Is that clear? Yes or no? They may have the polyp as well, bleeding polyp. Yes? But the first high suspicion we should go for what? Colorectal cancer. Is that clear? Young patient, painless bleeding, first suspicion should be internal. Is that clear? Later we'll discuss the acute abdomen and the different disease of this acute abdomen. So let's see this one about the hemorrhoids. What do we see here? What is hemorrhoid? If anybody can define, please. Hemorrhoids. So let's review this anal canal once again. This is the anal canal, yes? Yes or no? Inside the anal canal we have the, what is this one? This one? Anal columns. What are they? Anal columns. What is this one? This one. Anal valve. What is this one? Anal valve. Now, no side talk, please. Just see here. Okay? Concentrate. This is a very common disease you will face. We have discussed this anatomy in details. Yes or no? So you should know these fours. They are what? Anal columns. This one is anal valve. Joining this imaginary line, this is what? Pectinate line or dentate line. Yes or no? And what we see here, how these anal valves were formed. This was what? Superior rectal vein. This superior rectal vein has 6 to 10 tributaries. Yes or no? Those 6 to 10 tributaries were going inside the mucous lining. Yes or no? Because of these veins, these mucous lining were bulged out. Yes or no? Those bulging are called what? Anal columns. Then inside these anal columns, what do we have here? The tributaries of the superior rectal vein. How many numbers? 6 to 10 in numbers. Is that clear? Now one thing more we have to understand. This is the mucous fold. Inside the mucous fold we have these veins. What are those? These are veins. Surrounding these veins, within this mucous membrane, it contains the connective tissue. What does it contain? Connective tissue. Now you should understand, within this anal column, the structure contained in this anal column are venous plexus, veins, yes or no? Connective tissues, yes or no? And the covering mucous membrane. Understood or not? How many things they made the anal columns? Mucous membrane, connective tissues, and then the veins inside. Is that clear or not? All of these columns has the similar structure. Understood? And within this area, these anal columns are arranged in 3 rows. In how many rows? 3 rows. For example, this is your complete anal canal if you see from outside. Yes? These anal columns are not distributed equally and evenly throughout the circumference, but they are distributed in 3 rows. In how many rows?
3 rows.
3 rows. One row of the anal columns are on this side. Next row of the anal columns are on this side. Next rows of anal columns are on this side. That means within this row, this contains the collections of the anal columns. It may contain 2 to 3 anal columns inside. It may contain 2 to 3 anal columns inside. It may contain 2 to 3 anal columns inside. Do you understand or not? Yes or no? So these collections of these anal columns, which contains what? Veins, connective tissues, and the mucous membrane. Is that clear? These collective anal columns, these are called hemorrhoidal plexus. What are they called? Hemorrhoidal plexus. So what are hemorrhoidal plexus? What are hemorrhoidal plexus? The collections of the anal columns. Collections of the anal columns. In how many rows they are arranged?
3 rows.
3 rows. Inside the anal canal. Inside the anal canal. If you keep the patient in the lithotomy position, this is the picture of lithotomy position. Yes. These are the thighs, abdomen, and this is the anal canal. Yes. Putting the proctoscope and looking inside, you will see 1 rows of the anal columns in this area, next rows of the anal columns in these areas, next rows in these areas. Is that clear? These are called what? Hemorrhoidal plexus. Is that clear? These hemorrhoidal plexus, let's see. One is coming from this side, next coming from this side, next coming from this side. If you look from here, making this or imagine this as a clock. As a clock. This is 12 o'clock. This is 6 o'clock. This is. So these hemorrhoidal plexus are present in how many positions now? 1, 2, 3 positions, right? One at the 3 o'clock, next at the 11 o'clock. Is that clear? So they're making what? Hemorrhoidal plexus. What does the plexus contain? Anal columns. Anal columns are formed by what? Blood vessels, connective tissue, and mucous membrane. Is that clear? Don't forget these 3 things. They are very much important in developing the pathology. Is that clear? Yes or no? Okay. If you understand this, let's go forward. Similar to these hemorrhoidal plexus, this is what? Dentate line. They are situated above this dentate line because anal columns are here. Yes or no? Next venous plexus, let's see. This is which vein? We have the next, what is this one? Middle rectal vein. And then what is this one? Inferior rectal vein. Similar to these plexus, outside of these, what are these? Muscle fibers, internal sphincter. We have the external sphincter also here. Is that clear? Yes or no? In between these, or even outside of this also, we have these venous communications here. Is that clear? They are also forming the plexus like this outside. Is that clear? Outside the sphincter, both sides, they are also forming the sphincter. They are also forming the plexus. Is that clear or not? Understood? That's why those plexus which are present inside the anal canal above the dentate line, we call them as internal hemorrhoidal plexus. What do we call them?
Internal hemorrhoidal plexus.
And those plexus which are present outside of these sphincters, what do we call them? External hemorrhoidal plexus. Are you clear? So these hemorrhoidal plexus are normal or abnormal? These hemorrhoidal plexus are normal or abnormal? They are normal. They are present there. They are normal. But if they produce some symptoms of difficulties, is that clear? Symptoms of difficulties. Now this is called what? This is called what? Hemorrhoids. What are they called?
Hemorrhoids.
Hemorrhoids or piles. Understood? Do you understand the difference between the hemorrhoidal plexus and the hemorrhoids? Is that clear? Yes or no? If the problem is seen in the internal hemorrhoidal plexus, we call this is internal hemorrhoids. If the problem is seen in the external hemorrhoidal plexus, then we call this one external hemorrhoids. Is that clear or not? Yes or no?